following the confirmation of coronavirus, COVID-19, cases in Kenya announced by His Excellency the President, Uhuru Muigai Kenyatta, the Elgeyo Marakwet County Emergency Response Committee, chaired by myself, hereby gives the following advisory in a bid to mitigate the spread in the county. One, we've decided to suspend all weekly open-air markets and livestock auction days across the county for the next 30 days. So these are auctions that we normally know that there are traders across the region moving from one county to the other, doing or selling their wares in an open air market. And after deliberating, we realized that these are people who interact with so many people. They use public transport, and they always move from one corner of the county to the other, and also move to from county Elgeyo Marakwet County, Uasin Gishu, and across the region. So for the next 30 days, all the open air markets and livestock auctions will be suspended. And we urge the traders, especially the butchers or the traders who normally go to buy livestock, they can deal with individual farmers. And we know always when we have quarantine, or even when there is a disease outbreak, they normally have ways of ensuring that there is continuous supply of meat and other products. Number two, we suspend all hawking activities across Elgeyo Marakwet County. You've realized that this coronavirus spreads when we handle wares or we transfer from one person to the other. So from now moving forward, all the hawkers who normally move across our towns, we have suspended their activities. The third one, as you know, Elgeyo Marakwet is a known destination for athletics training. We have issued closure of all athletic training camps and gyms, with the exception of individualized training. So you've realized that even this morning there are a number of athletes who are still training in a large crowd, and we are encouraging that now if an athlete has to train, then they should do that on an individual basis. And all the athletics camps, because we know some of them are living in conditions same as the ones for schools, and following the directive by His Excellency the President, all the athletics camp now in Elgeyo Marakwet has been closed. And we are aware also that our neighboring counties have also issued the same. And the fourth one, closure of all nightclubs across the county for the next 30 days. Hotels should maintain hygiene and avoid overcrowding. And in that case, 1 meter distance to be maintained. So when you visit some of these hotels, ensure that the place is well kept. They should ensure that hygiene is kept. Every public place, they should have at least an hand washing area before entry and after even leaving the facility. All public institutions to introduce hand washing facilities, that is water and liquid soap, in all their premises. This includes supermarkets, shops, banks, postal offices, police stations, bus stages, and all the other areas where they attract many people going there to seek for services. The other thing, all visitors to county offices are encouraged to use other forms of communication and avoid visiting the offices unless it's absolutely necessary. Because we realize that our offices, as much as we offer services, we realize that there are things that can be sorted out using even telephone conversations. So we encourage our people, unless it's absolutely necessary, they should just seek services using other means. County Referral Hospital and 5-bed ward at Kapsawar Mission Hospital. We are also in the process of establishing an isolation ward at Chesoi, Chepkorio, and Kapcherop. The county has trained 30 medical staff who will train other staff in managing the disease, including community health volunteers. And we have also established an hotline, and the number is 0740 800 530. 0740 800 530, which is available 24 hours. Members of public are also advised to seek medical attention in the nearest county medical facility in case they get the following symptoms: dry cough, sneezing, fever, and difficulty in breathing. And I believe that the health personnel in all our facilities will be able to give them direction. And in case of any sign that indicates the above, then we'll be able to move the affected or the cases to the county referral hospital, which at the moment has established an isolation ward. I also want to confirm that last week there was a suspected case which we took the samples to Moi Teaching and Referral Hospital, and I'm happy to confirm that the results we got were negative, and at the moment there is no cause of alarm in Elgeyo Marakwet County. I think there's a problem in this country where every time there is a directive that is issued, it has to be enforced by maybe the law enforcing officers or the county enforcement team. But we want to urge our people that this time round, this case is very serious, and we want to request them that whenever a directive is issued by the national government or the county, it should be adhered to without even any enforcement. But in the meantime, we've instructed all our public health officers in all the sub-counties to ensure that this is being effected. And again, we are in liaison with the county commissioner, who also co-chairs the county response emergency team, to ensure that we work together in ensuring that all this is followed. Already we've taken 30 members of staff, all health staff, not nurses alone, for training at Moi Teaching and Referral Hospital, and these are the same people who are going to train the other staff. And as we speak now, we also have another meeting going on at the Kenya Medical Training Center, where we've invited all the hotel owners, the coaches for athletes, and other people who handle a large number of people in their premises or in their workplaces. They are being trained at the moment. And we cannot say that the county can just wake up and ensure that all these people are trained. This is a continuous process, and we urge our people to cooperate with us so that we are able to deal with the situation at the moment.
Mr. Governor,
something which came up, and remember also the suspected case was for a foreigner, and we appreciate first of all the direction or the steps taken by the national government, because at the moment we are being told that all foreigners are stopped from entering their country, because we know that there were so many others who are still coming from across the world, coming to train here in Iten. So at the moment what we are saying is that stopping this overcrowded training, and even the camps where people live in hostels and crowded places, then we ensure that those who are already within the country are able to maybe stay in areas where they cannot interact so much with the members of public. But as for whether these people will continue coming or not, I think that is something which we need the intervention of the national government. And already we are happy because they've stopped all foreigners from coming. What we are only doing now is to ensure that the ones who are there are discouraged from mass training with the rest of the Kenyans.